Hi and welcome back to the channel. Today I'm going to talk about two great Master Tung sets of points that work on the do mai. For practitioners of distal acupuncture, sometimes the do mai might seem like a big challenge. Well, if you work with the balance method, you'll have 5 systems, depending on the approach, maybe 6 systems to treat each of the 12 regular channels. But when thinking about treating the do mai, you only have the do mai itself or the hen mai. So you have a lot less options. And if you look into Master Tung's approach into treating the do mai, you will see that you also don't have as many choices as you might find for other areas of the body. But the do mai is very important because, as I'm sure you've already figured out, when we talk about the do mai, we're talking about the spine. So there are a lot of patients with spinal problems. So basically what I'm going to be talking about today is not just the do mai, but how to treat the spine using Master Tung. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balance method to treat pain. This is a technique where you get instant relief in most pain cases, so if you want to learn about it, check them out. And there are more options than what I'll show you today, but in this video I'll talk about 2 sets of points which are amazing and allow you to cover all of the spine using just a very small area of the body. So with just 2 needles you'll be able to cover the full area of the spine. This is amazing because depending on what you're treating, maybe you already have a lot of needles, you don't want to do the scalp system of Dr. Tan and cover the scalp with the 5, 6, 7 needles to cover a wide area of the spine. And with these points, you'll just use 2 needles to cover the full spine. Also, if you don't know what I'm talking about when I talk about the scalp system from balance method to treat the spine, let me know in the comments and I'll do a full video on how to treat the spine using the balance method and how to balance the do mai using the scalp points. But now, let's dive into the 2 sets of points that we're going to be seeing today. These are both points in the hands, so points from zone 11. And the first point is 11.11 or Fei Xin. Fei Xin can be translated as lung, heart, and as you might imagine, the points have the shunjing of the lung and the heart. As you can see here in the image, these points are located in the middle phalanx of the middle finger on the center line of the dorsal side of the hand. So what we might think of as the opposite of the pericard channel. As an indication, it is mainly to treat the cervical spine. So any kind of cervical problems, especially if it involves the do mai or the spine, you can think of these points. A question that I always get asked is, should you use these points on the same side of the pain or opposite side? First, if you're talking about strictly over the spine, it's a central area, so that question doesn't apply. But if the pain has one main side, you should use these points on the opposite side. As a rule, most Master Tung points for pain are used on the opposite side. So when I'm talking about a point for pain, if I don't say specifically use it on the same side, it's a safe bet to use it on the opposite side of the pain. So this point has as main indications cervical problems, headaches, especially occipital headaches, and pain in the legs, but the main application for this point is cervical pain. As sometimes we see in Master Tung's points, especially in points in the hand, you see that we have a single point name, but we actually have 2 point locations. So these are 2 points. And typically we're going to use these points together. And the way I like to do it is to thread the needle over the 2 points. This might sound scary, especially in the hand, but if done correctly and with good needles, there's no problem in doing it. As you can see here in this video, you just find the points, you do a pinch on the skin, and you just thread the needle through. Of course, this is very shallow because in this area you don't have a lot of muscle. It's mainly just skin and bone, but it's not painful. You can do this either distal to proximal or proximal to distal. Therapeutically, it makes no difference. I find it easier to do distal to proximal. And so, with just one needle, you'll be able to cover all of the cervical spine. And now for our second set of points, we're going to look into 11.12 or Er Jiao Ming. This point, the name can be translated to two illuminated corners, and they both have the shunjing of the kidney. These points are located exactly as we saw with 11.11, but in this case in the proximal phalanx of the middle finger. And these points are widely regarded as some of the best points for lumbar pain, especially if it's pain over the spine. And we're going to do exactly the same thing as we did with 11.12. We're going to do a small pinch and we're going to thread the needle through both these points. And if you look at what we're doing here, you can see if we create here an image, we could think about the head at the tip of the finger, and then you have the back and you go through the full spine. As for classical indications, you will see that we're talking specifically of cervical and lumbar areas. So we have some spine missing here, but in my experience, if you want to treat the full spine and you thread 11.11 with one needle and 11.12 with the other one, it will affect the full line of the spine. So you can think of the back of your hand and the center line as the dumai. It's a very elegant representation of the dumai and a very simple application. These points are very effective. In most cases of pain, you will see very quick results. Of course, if we're talking about structural problem with the spine, maybe the patient will need a lot of treatment to see consistent results. In some cases, it might be something that you'll have to do a maintenance for his full life to be symptom-free, but you will almost certainly see a reduction in pain right after you insert the needles. These points are amazing, and this is a very nice way to treat the full spine with just two needles. So you have a lot of room to add other points to your treatment. So maybe you're doing a full treatment in the body and you use two needles to cover the full spine. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it. And I'll see you in the next one.